Good morning and welcome to the Philanthropy Asia Summit. And it's a pleasure today to have His Excellency, the Honorable Minister, Mr. Budi Gunadi Sadikin, to join us. And as Madam Ho Ching has mentioned, he has taken an extraordinary effort to fly in this morning just to join us for this particular session. Despite his busy schedule, he has fully committed to spending this time with us to address any of your questions you may have during this fireside chat. To open the session, please allow me to give a very brief introduction to our guest speaker, Pak Budi. Pak Budi began his long and distinguished career in the IT and banking sectors, working initially at the IBM's Asia Pacific headquarters in Tokyo, and progressing up the ranks, eventually becoming the manager of the systems integration and professional services at IBM. He subsequently joined the banking sector and had distinguished contributions, working in several banks through various managerial and leadership roles. And through his contributions in the banking sector, he provided very strong leadership, helping the sector weather through two economic crises in 1998 and 2008. After completing his tenure at Bank Mandiri as the President Director, Minister Budi served as a senior advisor to the Minister of State-Owned Enterprises in Indonesia from 2016 to 2017. He subsequently served as a Group Chief Executive Officer and later Chairman for PT Indonesia Asahan Aluminium. Minister Budi was appointed in 2019 as the Vice Minister of State-Owned Enterprises and was tasked to establish market-leading and globally competitive state-owned enterprises in Indonesia. And as the COVID-19 pandemic took root globally, Pak Budi led Indonesia's National Economic Recovery and Transformation Task Force in 2020. Pak Budi was appointed into his present position as the Minister of Health in the Republic of Indonesia in December of 2020 and successfully implemented Indonesia's national COVID-19 vaccination program to achieve a high vaccination coverage among the Indonesian population, leading efforts to bring the pandemic in Indonesia under control. Pak Budi has played an active role in the international arena, hosting the ASEAN Health Ministers Meeting and the G20 Health Ministers Meeting in Indonesia in May and June 2022, respectively. He played an important role in supporting the establishment of the Financial Intermediary Fund for Pandemic Preparedness and Response, working with global pharmaceutical industry partners to ensure there was sufficient capacity to manufacture vaccines and therapeutics for low-income countries. Presently, Minister Budi is also a member of the steering committee for the World Economic Forum, Distributed Vaccine Manufacturing Collective, which addresses vaccine manufacturing issues for pandemic preparedness. Minister Budi has championed for greater regional cooperation on common healthcare challenges affecting ASEAN countries, particularly with respect to emerging infectious diseases and public health threats. And as the COVID-19 epidemic now eases in many of our countries, Pak Budi now leads Indonesia's efforts to improve the quality of healthcare services, build additional healthcare capacity to establish greater resiliency, provide basic universal health insurance to promote greater access to care, and to provide more opportunities for healthcare innovation in Indonesia. So ladies and gentlemen, please welcome Minister Budi again to this fireside chat. I'd now like to invite Mr. Budi to give his opening remarks, and then that could set the stage for further questions.
Thank you. I just come here for one day because three specific reasons. The first one, maybe not many people understand here, that I used to work for Madam Ho Ching. Between 2004 and 2006, I worked for a bank called Danamon, which is owned by Temasek. So I have to pay respect for her because she used to be my boss. The second things that make me come to Singapore because I would like to meet my friends and my fiercest competitor. His name is Piyush Gupta. So, because I used to run the largest bank in the country and he used to run, I think he is still running the largest bank in Singapore. And we are competing like hell. But I can, after 30 years in banking, I just be a minister in health industry for 1 year and 9 months. So don't expect me to understand a lot of things about health. But I know more about banking than health. But after 1 year and 9 months in health and 30 years in banking, I can share with my friend Pius that the best advice that you can give to your clients is the biggest and the best wealth is health. Pius. So give that advice to your client. I think thinking about changing career from wealth business to health business is a good thing to consider. The third thing, this is not many people understand also. During the Delta peak that kills thousands of Indonesians, we need oxygen. So we realized that we have 3,000 hospitals that spread over 17,000 islands. And at that time, the number of patients in Indonesian hospital reached 100,000 people, with the total capacity of 100,020 for COVID. Hospital bed in Indonesia is around 300,000, but we dedicated 120,000 for COVID. Almost 100,000 is already occupied. We realized that it's impossible to distribute in terms of oxygen in the camp. So we need oxygen concentrator. And to buy and distribute the government budget, there is a procedural process. So it's difficult. So I'm looking for the contribution for the private sector. And we have calculated that we need 18,000 oxygen concentrators to be distributed quickly across 6,000 islands, populated islands, and 3,000 hospitals. We have give the list, give it to the private sector that would like to contribute. And not many people understand, out of 18,000, the government of Indonesia supports 6,700. And you know the most? 7,000? Temasek. So here I would like to thank you. That is the reason that actually I come in the morning and leave in the evening, because I would like to thank Temasek. You save Indonesian life. And I think it's not only Indonesian life, it shows that it is a tribute to humanity. So thank you, Temasek.
Thank you very much, Pak Budi. We'll start the fireside chat with questions that any of you could have. Please let us know if you have any questions. I think there's a QR code that's been provided, which can allow you then to type those questions in. But if you wish to perhaps verbally bring your question out, you could raise your hand. If I see you, I'll acknowledge you and give you an opportunity then to ask that question. But perhaps I'll start off by asking Pak Budi some of his plans now as COVID, the situation in Indonesia gets better and better with the numbers coming down. I understand you have turned your attention to efforts to transform the Indonesian healthcare system. Could you share with us a little bit of what you see as the important areas to work on, and what challenges you might anticipate that would need greater emphasis?
Yes, I've been in financial sector and see many financial crises. And every time we saw financial crisis, I remember in Chinese, there is two characters, Wei Qi, right? And I didn't speak Mandarin, but they said that Wei Qi, you can use the character Wei Shen means danger, and Qi Hui means opportunity. So in a great crisis, there is always a great opportunity. Only through great earthquakes, lofty mountain rises. So when Pak Jokowi asked me to become the health minister, he said that, Budi, your job is 3. Execute the vaccinations. Number 2, overcome the pandemic so our economy can recover. And number 3, do major healthcare reform, transformations. And I only have 3 years and 9 months because I don't have a full 5 years. I did the first 2 jobs in 1 year, 3 months. So I only have 2 years and 6 months or 30 months to do the most difficult part of the job, which is the major healthcare reform. Now I spent already 6 months, so I only have 24 months to do these major reforms. So we have established 6 strategies in the reform. The first one, which is closer to my heart, is the primary healthcare reform. This is the key of Indonesian healthcare transformations, where we have to focus on promotive and preventive actions, how to make sure our people are keep healthy, not curing sick people, but to make and maintain a healthy people. When I came to the Ministry of Health, 80% of my budget, 80% of my time is working how to cure sick people. I don't blame anything, because doctors are trained, 10 years, 12 years, how to cure sick people, not to maintain a healthy population. So that is my first strategy, and I'm very committed to do it. The second strategy is to do transformations in the hospitals, secondary facility. The third strategy is healthcare system resiliency, the pharmaceutical, the drug industry, the healthcare, the reserve healthcare army, I call it. The fourth reform is healthcare financing. The fifth reform is healthcare human resources, which is very, very critical. And the sixth reform is reform in healthcare technology. I split into two. The first one is healthcare information technology, and the second one is healthcare biotechnology, which is very, very important for Indonesia. So those are the 6 major reforms in healthcare industry that we would like to do.
Thank you. We have several questions have come in. I think one related to your vision for Indonesia's healthcare system, which we've also shared in relation to the reforms that are underway. We have another question, particularly in relation to access to care. The question asks, given that there are many socioeconomically disadvantaged people in rural areas, what can be done to reach out to them to improve their access to primary care?
Indonesia is very lucky, and it's not happening during my time, but during the previous, leaders, they understand that we need a reach. So as a bankers, I give loan to many retail clients, the Indofood, the Sinarmas family, they have a retail industry, the Coca-Cola, the Unilever. I understand when I'm in banking, the number of Indonesian population that have bank accounts is only 60 million, 70 million. The central banks at the time, Pak Darmin Nasution asked me, Budi, why our financial inclusion is very, very low? I said, Pak Darmin, I'm giving loan to the cigarette companies. They are the best clients of the bank. The smoking inclusion is much better than financial inclusion. We have more than 100 million Indonesians smoking, and only 60 million Indonesians having bank accounts. You know why? Because your mistake. Why? Because it's so difficult to opening a branch in Indonesia. We only have like 60,000 branches. All the retailers company, at least they have 300,000 outlets. So that is my rule of thumb. You need at least 300,000 outlets to serve, selling or servicing, to have a reach to cover the 270 million in 6,000 populated islands across the country. So when I come to the Ministry of Health, that is a number that I have in my mind. I have to at least 300,000 healthcare facilities. And when I look at the hospital, only 3,000, forget it. I look at the puskesmas, 10,000, forget it. Even you put an angel, you will not be able to serve the Indonesians because of the geography. But we have the posyandu, 300,000. So somebody is very smart before me has established a posyandu mechanism with 300,000. The problem with Indonesia in 2004, when the new law was introduced, we become very decentralized. So that is not a standard delivery of healthcare services on the posyandu. It very depends on the political leaders. So now what I'm doing in the primary healthcare reform, we standardize. So the posyandu, 300,000 at the dusun level, these are the standard healthcare services. And not only for babies and mother, there used to be only babies and mother, but for the complete life cycle. This is 15 healthcare services that you should deliver to every houses by the 5 to 10 teams of every posyandu. So we have 1.5 million to 3 million cadres that cover all the dusun and villages in Indonesia. You go to puskesmas, we have 10,000 puskesmas. We increase the services to 30 healthcare services, and mostly promotive and preventive. And all will be digitalized. So hopefully that will help, pushing the primary healthcare services to the Indonesian people.
Pak Budi, you've mentioned about the need for digitalization and to achieve a digital transformation. What do you see as the necessary ingredients for Indonesia then to achieve that digital maturity that allows you then to go that final mile to improve access to care?
In Indonesian digitalization, in terms of infrastructure, surprisingly now is not that bad. So I have to thank the Ministry of Telecommunication to lay down the Palapa ring and the infrastructure. In terms of literacy also, Indonesian is quite savvy. Yeah. That's why as a bankers, I help facilitating some of the information's IT unicorn in the country. Indonesia is quite successful in terms of IT unicorn. So it's there. The facility is there. Now the issue is how we facilitate. I give you an example. Two examples I can give you 3 examples during COVID, how we did that. Vaccinations. Indonesia vaccination, we don't have the data by name, by address. And during vaccination, it's very difficult because when we have the by name, by address, we would like to communicate with them. And you have to come to this location and you have to register. So we are lucky that WhatsApp is the most widely used in Indonesia.
Yes.
When we try to use it, they would like to charge us. I'm very lucky, suddenly I meet with this CEO of WhatsApp, Bill Cartwright, and we have a Zoom. And maybe he pity me because this, Ministry of Health knows nothing about health, and he said, Budi, I give you for free. And then I got free WhatsApp. And suddenly WhatsApp is being used to communicate the vaccination program. They have the chatbot facility that can register automatically, and suddenly is widely used. So for WhatsApp, it became very popular, and then Bill called me back and said, Budi, I was invited by United Nations to give a speech because it's very successful. I have a slot to speak in United Nations General Assembly for this. So it is a good one. But I tell you my failure. I failed to negotiate with Google. I would like to have a geotagging facility of all my vaccination program so I can see, oh, this one is still yellow, this one is still red, this one. They still want to charge me for every geotagging, it's bloody expensive. I failed to do. But that is one of the examples. Another example is during the Delta, we have problem because the number of people that going to the hospital is so many. We have death of the doctors. All the doctors are very afraid to deal with them. So suddenly, because I deal with the investor, Wilson Cuaca is here, he's one of the most successful venture capitalists in Indonesia. And as a banker, I know all of them because it's related with money. I said, and they're coming to see me. We have several telemedicine startups, but they are not allowed to do the operations because the license, the Doctors Association is very strong, they cannot do across the cities or whatever. Okay, all the doctors now is very afraid to do face-to-face treatment, right? Then I lobby the Doctor Association, you are afraid. Okay, but you still want to do your service, right? For humanity. Okay, why don't we do it with the telemedicine services? So 17 telemedicine services suddenly got the license to deliver the services. So when the Omicron hit, actually it's higher, the daily incident, from 57,000 per day to 62,000 per day. But now we have the telemedicine services. So we have an automated detection. When you go to the lab, PCR test, we did 500,000 tests every day at that time. Automatically goes to the database, linked to the telemedicine services. We send a WhatsApp. They can call the free telemedicine services, and when they get prescription, we work with another startup company, the logistic company in Japan, and we send the package to their home, and they feel covered, safe, so they don't have to go to the hospital. So still giving free healthcare consultations by the doctor to the patients and send the medicine so they don't have to come to the hospital, so the hospitals are free. That's why during the Omicron cases, we can push hundreds of thousands of people to stay at home because they can get free consultations and also free delivery of the medical services. And that is the first time we got praise. Usually as Minister of Health, every time I got screwed in the social media. This is the only time I got praise in social media.
Pak Budi, you've given very excellent examples of how public-private sector collaborations and partnerships can really go far towards improving the health of Indonesians, particularly in relation to COVID. Where do you see the value of philanthropic contributions as well, and how can the public sector partner with philanthropists to achieve your vision for Indonesia in the next mile?
The best example that opened my eyes, the reason that I call Lawrence to come to this meeting. Actually, I'm not in the schedule, but there is somebody sent me about this, and I just met Lawrence before he became the Deputy Prime Minister because he wanted to see me for whatever reason, I don't understand. So this Ministry of Finance want to see a Ministry of Health. I said, okay, then we met. He is a very humble person. And then I just realized that he became the Deputy Prime Minister. You know, I said to Lawrence, I would like to speak in this meeting. The reason why, during the oxygen crisis, I realized that we don't have enough speed to execute. And I'm a man of executions. I don't really care whether it's government money, who buy this, or whatever. What important to me is how to deliver the services to the user as quickly as possible. And I know the government doesn't have the speed to do it. The government of Indonesia, there is some bureaucracy, we don't have the speed to do it. And when I want to raise fund, then that is the reality, you know. Well, Temasek can get the oxygen concentrator faster. You know, I'm a banker, you know, KYC is very important to me. Check who are contributing to Temasek, and there are some Indonesian names, right? Wow, some Indonesian names. Of course, I know most of them. They are also borrowing money from me, or they used to borrowing money. So I talked to them. Why? Yeah. So there is a trust issues. So philanthropy, I think it's very basic. You need trust level, and country has a different. There is a trust level that any rich people can put to the government, and I'm very open and blunt about this. Like the Nordic countries, there is a countries where the trust level is very high to the government. Indonesia is improving. It is my job as the representative of the government to improve and to project that we are serious in improving the credibility of the government so people trust us. Trust is not something that you can get. It is something that you need to earn. So I said to them, if this is the case, then I need to earn this. So that is the reason that I come here. So you can judge whether this man can be trusted or not, because I cannot take it, yet I have to earn it. So then I learned this philanthropy funding is needed because it can accelerate it fast, it's big, but it needs to be earned. So that is the reason that I come here. And that is I believe, but Tommy, you go right, you go to the whatever Laksa together, but you have to make sure we need to project that we need to improve the perceptions of the public or the government of Indonesia that we are also improving ourselves, because then we need to earn the trust of the global community that we can do better, because we need that. And I will talk a lot about what we do need in the health sector. But because I heard about environment, I heard about education. Wow, if you want to save lives, then you can do a lot of things in health also.
Thank you. Pak Budi, Indonesia has been very successful in its presidency of G20 and the ASEAN chairmanship as well. And you've initiated on behalf of the healthcare sector many important initiatives, particularly to improve pandemic preparedness across borders, across nations. Can you share with us some of these achievements and how you think the private sector, countries and philanthropists can also get involved in this?
Yes. Why Indonesia is very active? The president would like to push health is one of the main agenda in G20 is because in the aftermath of World War II, in 1944 in Bretton Woods, global leaders sit together in the spirit of teamwork and solidarity. They established two great financial institutions called the World Bank and the IMF that help recover for the devastations of the World War II and protect the future financial crisis. So we live in the world of today after several financial crises after that. So after a huge health crisis that we had last year, so the global citizen then asked again the global leaders, what will you do? Are you going to sit together and talk, or you will repeat again what the global leaders did in 1944 and revamp the global health architecture like the global leaders did in reforming the global finance architecture in 1944. So that's why Indonesia is pushing forward to reform the global health architecture as the president of G20. And we have a very clear agenda. The first, we would like to establish the financial pandemic fund, which is already established. I think it was initiated not during our presidency, but failed to be executed. And I think Pak Tarman, I consulted him when I came here, have a great initiative, and I consulted him personally, what should we proceed with this? And we finally established this. And hopefully we can continue filling it. 1.4 billion is already there, approved by the World Bank board in June, by the end of June. And after that, we would like also to make sure the users of fund working with the private sector, how we can make sure the access to emergency medical countermeasures, therapeutic diagnostic tool, and vaccine. During the next pandemic, the protocols need to be determined. I think we don't have the protocols like the IMF. When you have the financial crisis, in 2 weeks, IMF can jump in and help you with the funding. If you have the health crisis, access to this vaccine, therapeutic diagnostic, every country has to fight that on their own. WHO can help you with the policies, but they don't have enough resources to really execute. It is very fragmented, different. Gavi, CEPI, Bill and Melinda Gates Foundation is a very fragmented role. Number 3, we have to agree on a single, genome sequencing lab, networking. It involves a lot of money and interest because it's, a lot of vested interest, but we need, at least in the pandemic, to agree on how to, on the protocol, how to share this. We need to standardize the health protocol standards. So when a good response for every crisis is to lock down. But if you lock down, you stop the movement of people and goods. You stop the economy. That will create social problem. That will create a political problem. So we need to make sure when another pandemic happened, how we didn't 100% lock down, but we have a certain health protocols for emergency medical countermeasure, and key energy or food related goods and services can still moving. And the last one, we need to make sure that we redistribute the global manufacturing hub and vaccine hub, especially for the global South countries, so everyone is safe. I know we are running out of time, but I just want to let you know that before closing, in Indonesia, the biggest burden of soul and biggest burden of money is heart disease. And if somebody got heart attack, you need to insert a ring inside. I just realized that in Indonesia, we have 514 cities. It's less than 200 cities that have facility to insert a ring. We have 34 provinces. Only 28 has facility to insert a ring. So if you live in Ambon, Maluku, and you have a heart attack, I asked the doctors, what happened with this guy? We have to pray that this guy is bring from Ambon to Makassar, Manado, 2 hours flight, and he still lives. I said to them, what have you done? 77 years Indonesia anniversary, and we don't have the facility. What do we need? Cath labs. How much is a cath lab? 15 billion. My budget is 206 trillion. Why don't we just buy for this 6 provinces? 6 months is done. Yes, Pa, we can buy. And then do it. but we don't have enough doctors to do it. And then I realized that we need 4 specialists to do it. And I calculate we need more than 4,000 specialists. So I just realized, the reform in the human resources, how many doctors that we actually need for these 270 million people? WHO said 1 for every 1,000. So we need 270,000 doctors. How many doctor practice in Indonesia? 120,000. So we lack about 150,000. How many doctors produce in Indonesia? 12,000 a year. 15 years. Oh, okay. 5 years ago, the same. 10 years ago, the same. So that is the reason why we moved to Singapore. But even we move everything to Singapore, Singapore will not be enough. So those are the simple things. And if you go to heart, you go to stroke, the second killers, you go to cancer, it's like that. So I need to accelerate, the fundamental changes in the Indonesian healthcare services. I have 2 years. I do whatever I can. But I need support also from others. And it's not only for me, but also for saving lives for the people, for Indonesia. So that is my closing.
Well, we've come to the end of this fireside chat. There are many questions coming up still, but I have to apologize. We don't have the time to go through all of them. But I think Pak Budi has given us very rich insights through his journey through healthcare, going through the pandemic and his current agenda, his priorities and the challenges he faces as he seeks to revamp the Indonesian healthcare system. And we wish him well in this journey towards excellence in healthcare in Indonesia, trusting that the public, private and philanthropic contributions and partnerships that he forges will benefit the people in Indonesia as well. So with that, please join me in thanking Pak Budi for a very rich conversation with the